I am very excited to introduce the next speaker. He was my chief resident, and he's a personal mentor, Dr. Thomas D. Willson from UCLA David Geffen School of Medicine, Division of Plastic and Reconstructive Surgery, section of craniofacial and pediatric plastic surgery. All of that means he has done a lot of work after.
You sound like some sort of super subspecialist.
Yeah, and he is from Los Angeles, California.
So thank you, everybody, for having me here. I'm kind of embarrassed to be giving a talk on my 10 years of experience, 2 talks after Domingo's 20 with the WSF, and I suspect a little bit more before that. But I don't have any disclosures. So I just want to talk about why I do mission work, why I think everyone else should, and then some of the things that I've run into that have caused me both ethical problems and just sort of broken my heart, and then maybe some solutions. So why do I go on vacation to do work? And the answer is because I can. This is one of the first patients I operated on a mission trip. She is also the very first patient that one of our speakers, Dr. Walton, operated on in Puerto Rico, which is sort of interesting. It's part of the U.S., but no one there could treat her burns. So Puerto Rico, interestingly, is a lot like Los Angeles, where I practice. If you throw a rock hard enough, you'll hit a plastic surgeon. But there's expertise without interest. There are also parts of the world, like I go to the rural Philippines or rural Vietnam, where there's interest but no expertise. So in either of those situations, you can make a difference. You can build local expertise if they want it. You don't have to be a surgeon to repair a cleft lip. It helps, but you can teach people to do basic operations. You can expand the local treatment options, and honestly, it feels good. So why do it as faculty member? Because you can teach your peers. This is Dr. J.P. Clausen, who is 84 years old and still going strong, teaching a general surgeon in the Philippines how to repair a cleft palate. This is Dr. Clausen teaching a surgical resident how to repair a palate. You can mentor your residents, and you'll teach them stuff, but they'll teach you stuff too. It lets you build a global network. I know doctors all over the place now. They follow up for me, they call me, they give me their problems. You can escape from hospital bureaucracy, or this is actually what happened in Los Angeles the last time I went on a mission trip. It's also kind of how I feel every time I come back and have a stack of charts waiting for me. But I say your hospital's bureaucracy because there's an electronic medical record in Puerto Rico, and there's one in the Philippines, and I'm sure sooner or later there will be one for me in Vietnam too. Why should residents and students do it? You get to learn about other healthcare systems. This is my OR in the Philippines. Yes, there are 2 beds. Yes, we're operating 2 cases at once. It's what they have, and it's how we do it. It's how you get through 50 cases in 4 days. You build personal and professional relationships. These are other surgeons, allied health practitioners, donors, and medical students. You get to do more because there aren't senior residents. You also have to do more because there aren't interns either. So there's no place like home. What do you do when there are too many patients? So I think the main thing that we can do is teach local providers. I like to do missions where I keep going back to the same place over and over again. I don't want to leave people without care. I don't want to leave people without follow-up. But the reality is there are more places than you or I or everyone in this room can go. So if we train locals to do basic surgeries, we can move on. Recurring trips, though, are important. This gentleman has had multiple attempts at palatal repair. Unfortunately, he's also 55, so he got triaged out on my last trip. We had 100 people in the waiting room in 4 days. You can't do it all. Here's another dilemma I run into. This is Michelangelo. If anybody here knows of a way to get this poor gentleman treatment in the Philippines, I would be happy to hear it. He has a large sarcoma. I can actually resect that. I can put that back together, but I can't do it in a community hospital where all you can do is gas somebody down, operate very quickly, and they wake back up. Unfortunately, UCLA is not super interested either. But what can you do about that? Well, this young lady started off with, I actually don't have her childhood photos, unfortunately, but this was all congenital nevus. And this is 3 years later. So if you keep going back, you can make a huge difference in people's lives. As I said before, you can build the local systems. You can use your benefactors. This is my most recent trip to the Philippines in Bohol, sponsored by the governor and the mayor of Tagbilaran. And unfortunately, I still couldn't get Michelangelo any help, but that's what you've got. You got to know when to say no. He's been coming for years now, hoping that someone will find him treatment, and I just can't. What else do you run into? Informed consent. I think we've all been in these situations where you can put a piece of paper in front of somebody and they will sign it because you're the only person who's ever going to try and work with them. But you got to do it like you do it at home. These are my consent forms from Puerto Rico. They're in Spanish. I write in Spanish, I speak in Spanish, and then I use an interpreter anyway, because despite growing up speaking both languages, I don't interpret for medical purposes. I talk like a child, because that was the last time that I had to use it meaningfully. And then take your time. These patients are just like your patients at home. Yeah, you got 50 cases to do, you're gonna be there until 1 in the morning. If it takes an extra 5 minutes per patient, you'll be there till 2 in the morning. It's gonna be okay. And then there's the post-hospital care. The solution is really easy. Local providers. So this is Carlos Giroud. He was the medical director at Carolina Hospital in Puerto Rico, where the foundation that I'm a part of started. He's an interventional cardiologist, but he can do basic wound care. If something breaks down, he can care for it. He can provide antibiotics and dressing changes. This is Natalio Debs. He's a plastic and hand surgeon. He mostly does breast augmentation, but he comes and sees every single patient that I see in clinic. And then he sees every single patient after I leave to take out their stitches, to take care of their wound problems. And if they need to go back to the operating room, he is there because I can't be. Telemedicine's another great option. He also calls me when he's got the patients in his office. FaceTime is a great tool, and you can use it worldwide. WhatsApp, you can use over the internet, it's free. And then there's the good results problem. This gentleman, as you can see, has a nice scarred palate. He's been operated on by several different surgical teams. If you don't keep going to the same place, you're never gonna know if you're not getting good results. This, unfortunately, is one of mine. It's a bilateral cleft lip. Unfortunately, only one side worked out. But the good news is, I went back the next year and I can fix this, and we did. Telemedicine gives you the opportunity to pre-op and post-op your patients. Anybody more complicated than a cleft lip or cleft palate, we see via WhatsApp beforehand. Debs sees them afterwards. Debs sends them over via WhatsApp if there's a problem. And then be honest about your abilities. There was supposed to be a cartoon here, but it didn't transfer. I do not do a single operation abroad that I don't do routinely at home. I know how to fix a carpal tunnel, but I don't do it in my practice because I don't have hand surgery privileges. I'm not going to do it abroad either. You know, it's easy to say, oh, well, I trained in general surgery. I haven't taken out a gallbladder in 5 years. I'm not going to go with Dr. Alvear and take out gallbladders. I'm going to go with Dr. Alvear and fix someone's cleft lip. So, it's time to wake up now. Here is my unsolicited advice on mission work. It's extremely rewarding, but can also be tricky. You've got to provide the same quality care you would provide here at home, in large part because I practice here at home. I'm licensed in Puerto Rico. It's part of the US. They can sue me just as well here. You got to recognize limitations of your environment. Puerto Rico, it's a JACO accredited hospital with an operating microscope. I can do a free flap. It's just that no one else there knows how to use it. In the Philippines, I can do cleft lips and I can't resect that sarcoma because he'll die. Involve local providers so that you get good follow-up, so that if they want to learn, they can. And then find a good thing and stick with it. That's all I have to say.
We have time if you have questions or comments for Dr. Willson.
Outstanding.
All right.
Thank you very much.